Some tests and questions require the patient to draw or write their answers. For example, in this screen, you must write the word that labels the item in the picture.
You could draw on the empty box by using your finger or stylus pen.
If the patient would like to try again or makes a stray mark, pressing the X in the top right corner of the box will erase the entire image. All patient writings and drawing samples will be included at the bottom of the final report, so you could have a copy of their writing sample at baseline. Some questions require the patient to indicate the correct picture by touching. The image will become highlighted when touched. However, the question will not indicate if the answer was correct or incorrect. Other questions require the patient to listen to an audio file. The green play button on the question screen will automatically begin to play when touched. Remember to indicate if the patient answered the question correctly by pressing yes or no on the bottom.
This question type is for questions that are multiple choice or require the patient to recall a list of items. The correct answers are listed in a blue box. When the patient correctly states the answer, touch the box. It will change colors to indicate if it was answered correctly.
This feature helps the therapist to keep track of what the patient answered correctly. When the patient has completed the questions, the therapist will clearly be able to see if the patient has met the criterion for answering correctly. If the patient met the criterion, choose Yes on the bottom to indicate if they met the criterion. The criterion, if any for that question is required, will appear as a note for the therapist as seen here.